Hello, I'm Gary Bibo. I'm the CEO of White River Health System, and this is the first of my monthly videos that I'm going to have for the purposes of communicating to the hospital employees. I think it's really important to communicate effectively with you folks, to just keep you up to date on what's happening here that may be of importance in and around the system. I also want to use this as a way to address certain specific concerns and topics that may be of interest to you, and at the end of this program we'll give you some ways to submit that questions directly to me. And also I want to use it as a way to praise employees and staff for some of the great work that we're doing here at the hospital. So let's kind of get started. First of all, I want to talk a bit about the results of our recent ED employee campaign, where you as a staff, some 481 of you, participated in giving up $256,000 towards the emergency department expansion program. You know, that program is so important to us in terms as we try to do a better job of providing emergency services to the community. We'll have additional beds available for patients to be seen in. We're confident that the throughput will be better, and we'll just really have a better image out of the emergency room as a result. But importantly, from the campaign perspective, is that by way of us giving monies to the campaign, it really sheds us in a better light when it comes to others that sees that if we're supportive of the campaign, they should be as well. And so, as much as important that you all gave your monies to gave to the campaign, it also just says a lot about us as a group, and for that I'm really proud of what you've done to make that happen. You know, last couple weeks ago we had a very important vote at the state level on the Arkansas General Assembly, where they voted in favor of the private option to expand the insurance to Arkansans of low income levels. And so I know a lot of you really got involved by contacting our senators and our state representatives, and only as a result of that effort were we able to successfully get that passed. That means about $4.4 million in additional reimbursement to White River Medical Center, and about $155,000 a year in additional reimbursement to Stone County Medical Center. And so, boy, that was a really important thing. And so for all of you that got involved, I really appreciate that. National Hospital Week will be beginning on May 12th to 18th, and we've got some great events coming up. We'll be having an employee hamburger hot dog cookout at the main entrance of the hospital on Wednesday from 11 to 1 o'clock under the main entrance of the hospital, and then again that night from 9 o'clock to 10 o'clock. On Saturday, we're going to be doing the same thing with hamburgers and hot dogs on May 18th from 6 to 8 o'clock at night. So I hope that you can come out and let us all have some great time together celebrating National Hospital Week. Finally, every 6 months I have employee forums where we bring you all up to date on some of the most important metrics for the hospital. And at that time we'll talk about such things as Employee of the Month awards. We'll talk about how we're doing in patient satisfaction, how we're doing in quality, how the hospital's doing financially, how we're doing with our employee relations, and also how we're doing in our growth. And so we're putting together the programs. It'll start next week. The first one will be on May 9th. In addition to those things I just mentioned, we're also going to have a special presentation by the Employee Cost Control Committee. And so representatives will be there, and they'll be talking to you all about some of the good work they're doing to try to make us a better and more viable institution. So that's all I'm going to talk about today. Look for us every month, and again, if you have any suggestions on how we can make this better, be sure to let me know through direct email to me or through the other alternative that will be given to you at the end of this program. So thanks a lot. We'll talk to you next month.